My name is Brooke Massengill, and I'm going to be performing continual bladder irrigation on my patient. I'm going to come into my room and I'm going to wash my hands, and I'm going to come over, introduce myself to the patient, and check patient identifiers. I am going to follow all of my policies, procedures, and go ahead and follow good body mechanics, hand hygiene, state and federal laws. And I'm going to let Randy here know what we're going to be doing. I am going to insert, if not already inserted, which is a sterile procedure, my 3-way indwelling. You can see it's already inserted for me. So I am going to go ahead. I'm going to put on a pair of clean gloves. This does not require sterile gloves. So I'm going to go ahead and put on a pair of clean gloves. And then I am going to, dependent on if I'm going to use my sodium chloride bags or my handheld irrigation system, which can be either saline or sterile water. I want to make sure that I have all of my equipment with me, that I am hooking everything up correctly before hooking it up to the patient. So I am going to place this into my port, and then place this one into that darker orange port right there. I'm going to make sure that I hang my bags. And then this is going to be my input. So this one is going to go to this outside port. And this is what is going to go through into the bladder to irrigate if it's got blood clots or anything that we need to flush out of there. I'm going to take my bag, and this is going to be my output, so what's coming out. So I am going to hook it to this middle port right here. I am going to place my bag on a non-movable part of the bed, i.e. the bed frame, never a bed rail where it can move or get jostled around or anything. There's also leg bags. You can do leg bags. They're a little bit smaller. If I need to take a specimen, I can take my first one out of my bag. Anything other than that has to come out of the port. And I will make sure that I am reassessing what we want to see for output. Is we want to see a pink lemonade color, not the deep reds, things like that. And if I am not using my bags, I want to my catheter fell out. I obviously would not just reinsert the catheter. So if I'm not using my bag solution, you never want to pull them out, because you obviously don't want to make a big mess. But what I'm going to do, this is either going to be sterile saline or sterile water, and I've got my syringe. So what I'm going to do is I'm going to fill the syringe, and I'm going to hook it here, push it through. I'm going to do that 3 times, and then I'm going to draw up 3 times, and I'm going to discard that, making sure that I am checking the output and there are no blood clots or anything for the patient. And as soon as I'm done with my continual bladder irrigation, I am going to, it depends on if they are, the order is to keep their catheter in or take it out. If so, I will take it out. I will have the patient take a deep breath for me, and I will very gently pull their catheter out. and then I will perform good hand hygiene. I will take off my gloves, perform good hand hygiene, make sure the patient is comfortable, put the bed in the lowest position, lock my wheels, and leave the call light in reach.